Hello, my name is Matteo Santin and I'm a professor of tissue regeneration at the University of Brighton. And the focus of my research is in biomaterials for medical implants and regenerative medicine. I'm also the director of the Center for Regenerative Medicine and Devices, a center that focuses its research not only to the traditional branches of regenerative medicine and devices, but also has a number of colleagues with biological and clinical expertise to provide insight that can indeed lead to knowledge-based technology in the different fields of medicine. We are based in different campuses of the southeast of England, where we enjoy the state-of-the-art facilities made available to us by our university. We also provide postgraduate qualification not only through the traditional PhD route, but also through a newly established Master in Research in Regenerative Medicine and Devices. But going back to my research, the focus of it in the last 30 years and more has been the elimination of the fibrotic capsule that is interposed between the tissue and the implant, in this case on the right-hand side, the bone tissue and the porous titanium surface, and that causes the long-term failure of the implant. The way we do it is by developing biomimetic biomaterials in the form of extracellular matrix analogs, macromolecules that can mimic the natural environment of the cell, providing the cell not only with the physical grip which is required, but also with the ability of stimulating the internal intracellular pathways of the cells and activate the cell to contribute towards the regeneration of the tissue. The way we do it is by synthesized hyperbranched molecules, molecules that have the form or the shape of a nanotree, whereby the root of the nanotree can recognize and bind to the surface of the biomaterial, whereby the uppermost branching generation can expose to the host tissue active biomolecules capable of stimulating tissue regeneration. The way we do it is through a adopted and adapted peptide synthesis, where with a solid phase, solid raising support, we produce hyperbranched molecules. These hyperbranched molecules expose amino groups, typically 16 amino groups, to which we then attach the bioligands recognized by the cell. I want to give you just a few examples of how these macromolecules, extracellular matrix analogs, can be applied to the surface functionalization of medical implants. The example I've chosen is the published work on hyperbranched peptides that have been functionalized with phosphoserine, the most potent catalyst of biomineralization in living tissues. We have demonstrated that this molecule can indeed be efficiently grafted on the surface of the biomaterial to the hyperbranched molecules to induce a fast mineralization of titanium, to induce a differentiation of progenitor cells adhering on this surface into bone cells, osteoblasts, and in vivo to lead to the formation of a tight network of the bone trabeculae, which is a clearly indication of the bone activity. The ambition has gone further, being able to regenerate tissue at the interface of a traditional implant has led us to developing methods of functionalization of 3D scaffolds and cell substrate for handling of cells prior to their transplantation in cell therapy using our technology. In this case, we functionalize linear polymers with our hyperbranched molecules. And the hyperbranch molecules can present bioligands like YIGSR, ICVAV, and others that can recognize the cell membrane receptors, and by doing that, stimulate the formation of tissue-like structure. We have demonstrated that on stem cells, whereby, unlike other substrates, our material can induce stem cells to form 3D spheroids like those found in a natural stem cell niche. And this depends on the density and spacing of the ligands we present. By reducing it, you can see on the right-hand side, the cells return to their traditional spread morphology, where they tend to lose their characteristics. In another application, we have shown that the same materials, cell substrates, can induce vascular endothelial cells to form a capillary-like network, which is more consistent than the one notoriously found when the cells are cultivated on a very well-known substrate like nitrogen. More interestingly, when the endothelial cells are combined with stem cells, the stem cells can form again spheroids at the anastomotic junction, being able to maintain higher level of stemness and being proner to the paracrine stimuli through the expression of specific receptors. We applied the same technology to the development of beautifully vascularized pancreatic beta cell islets, as shown in this image. When the dendrimers, and again these are the dendrimers that have been functionalized with the phosphoserine moiety, are added to calcium phosphate salt gels, we can demonstrate that the calcium phosphate salt gel improves their injectability properties. They induce progenitor cells to become bone-like cells, and when implanted in vivo, they accelerate the formation of bone. Likewise, when another type of dendrimers is applied to functionalize the porosity of tissue engineering scaffold for osteochondral tissue regeneration, you can see that compared to the control where the stem cells are spread, in the case of our functionalized scaffolds, we have again the development of stem cell spheroids, and the implantation leads to a physiological regeneration of both the bone and cartilage compartments. We are proud to say that these products have now reached the market with the name of PhenoDry and commercialized by our partner company Tissue Click. And I want just to conclude by recapping the main findings. Basically, we have demonstrated that extracellular matrix analogs can be developed at a scaled up and GMP conditions. They can be used in a variety of applications, including functionalization of implant, 3D tissue engineering, and bioinks for the 3D printing of the same scaffolds. And they can also be used for as a specialized substrate for the clinical handling of cells. This has shown that we can, so doing, developing clinically reflecting in vitro models that in the future can become important for the testing of drugs and nanomedicine. We like to acknowledge the EC, the BBSRC, and the Orthopedic Research UK that have been our major sponsors throughout the years, and we are open for collaboration, and we thank you for your kind attention.